Hi, my name is Simon Downing. The following presentation will identify the 8 Millennium Development Goals which were established in 2005 from the accumulated work of many and headed by the United Nations. Furthermore, an in-depth examination of Goal 5 will be presented, analysing the target areas and health promotion strategies being used to address determinants to health. Finally, these promotion strategies will be aligned with the action areas of the Ottawa Charter. The 8 Millennium Development Goals are to eradicate extreme hunger and poverty, achieve universal primary education, promote gender equality and empower women, reduce child mortality, improve maternal health, combat HIV and AIDS, malaria and other diseases, ensure environmental sustainability, and develop a global partnership for development. Goal 5 of the Millennium Development Goals is to improve maternal health globally. First target area of Goal 5 is to reduce the maternal mortality ratio by 3/4 between 1990 and 2015. This area is of particular importance due to the links associated between maternal mortality and infant mortality rates. A recent study looked at 25 years of birth rates in Bujara, Ethiopia, examining the impact of maternal mortality on infant and child survival. They found that of all maternal deaths, 81% of infants also died. Furthermore, babies whose mothers died were 46 times at higher risk of dying when compared to babies whose mothers had not died. Almost all of maternal deaths occur in developing countries. Developing countries have maternal death rates of 230 per 100,000 live births compared to 16 per 100,000 live births in developed countries. There are also significant disparities within countries where socioeconomic status is the key indicator for varying mortality rates. Between 1990 and 2013, worldwide maternal deaths have dropped by 45%. Whilst progress has been significant, the 2.5% decreases in maternal deaths is far less than the 5.5% decreases needed to achieve Goal 5 of the Millennium Goals. Some of the health promotions targeted towards reducing the maternal mortality ratio include CARE, a leading humanitarian organisation, focus on working closely with women in disadvantaged communities to overcome poverty. The primary aim of CARE is to empower women with the resources to improve basic education, end gender-based violence, provide healthcare and nutrition, increase access to clean water and sanitation, expand economic opportunity, and protect natural resources. CARMA are a humanitarian organisation who aim at improving maternal and infant health through a variety of promotional strategies. Their mission is to build on existing efforts to improve maternal, newborn, and child health across Africa, particularly by sharing best practice, generate and share data on maternal, newborn, and child health, advocate for increased political commitment, and mobilise domestic resources in support of maternal, newborn, and child health. Communicate with the wider African public and inspire action. The Partnership for Maternal, Newborn and Child Health is an organisation which enables partners of the Millennium Development Goals 4 and 5 to share strategies, align objectives and resources, and agree on interventions to achieve more together than they would have been able to achieve individually. The PMNCH work aims at improving knowledge, advocating policies, and highlighting issues in discussion forums, as well as accountability for resources and results. The second target area of Goal 5 of the Millennium Development Goals is to achieve universal access to reproductive health by 2015. This target area has been established because 75% of maternal deaths are caused by preventable complications arising during pregnancy and childbirth. In 1990, births which were attended to by skilled health personnel were 59% globally. This has risen to 71% in 2014. Whilst these improvements are impressive, the disparities between the developed and developing world are significant. Virtually all women in developed countries have at least 4 antenatal care visits compared to one-third of women in developing countries having at least 4 antenatal care visits. These disparities are more significant when comparing rural communities to their urban counterparts. The greatest disparities are again found in the developing world, for example in Central African nations, where the percentage of urban births attended by skilled health personnel was 82% from 2010 to 2014, compared to 32% of rural births. Whilst there has been improvements made, access to at least 4 antenatal care visits is still only 52% in developing regions. Action is needed to assess whether the interventions being used are effective, and if so, increase the necessary resources needed to meet universal access to reproductive health. Health promotion aimed at achieving universal access to reproductive health by 2015 includes the Universal Access Project is an initiative achieved by the collaborative effort of 7 foundations who aim to deliver universal reproductive health through advocating to policymakers and the public. The purpose of the organisation is to secure funds for international reproductive health and family planning. Their work has resulted in a 30% increase in US funding, reinstated funding for the United Nations Population Fund, federal policies, and development assistance, which is the centrepiece of the Global Health Initiative. Murray-Stokes International is an organisation which aims at providing a full range of reproductive services, including contraception, safe abortions where legal, and post-abortion care. The risk for maternal mortality is highest in adolescent girls aged 15 years and younger in developing countries. It is also in these regions where the highest birth rates exist for girls aged 15 to 19 years old. Murray-Stokes International's impact is considerable. African females using contraception has risen from 2 million in 2009 to just over 6 million in 2014. And 500,000 unintended pregnancies averted in 2009 to nearly 2 million in 2014. The Care Foundation addresses several determinants of health. These include education, gender inequality, provide healthcare and nutrition, increase access to clean water and sanitation, expand economic opportunity, and protect natural resources. Karma's efforts help to improve a number of the determinants to health throughout Africa. They improve the political commitment and mobilisation of resources to improve healthcare for women and children. The Partnership for Maternal, Newborn and Child Health helps to improve education, effective policy implementation, and resource inequality. The Universal Access Project addresses policies and financial assistance and allocation. Finally, Murray-Stokes International address political, economic, cultural, and education and healthcare. These health promotion strategies also align with the action areas of the Ottawa Charter. Care help to create supportive environments by improving nutrition and increase access to clean water and sanitation. Care strengthens community action by protecting natural resources and preventing domestic violence. They develop personal skills by providing education, and they reorient health services by providing healthcare. Karma build healthy public policy through improving political commitment, create supportive environments by improving health for women and children, and reorient health services by mobilising resources. Partnership for maternal, newborn and child health. Build healthy public policy through effective policy implementation. Develop personal skills by improving education. Reorient health services through resource inequality. The Universal Access Project advocates policymakers, which helps to build healthy public policy. And reorient health services by providing financial assistance and allocation. And finally, Mari Stopes builds healthy public policy through advocating against abortion laws, creates supportive environments by providing contraception, develop personal skills by educating on contraception and family planning. Thank you.